This podcast is brought to you by Conquer Cancer, the ASCO Foundation. Our mission is to accelerate breakthroughs in life-saving research and empower people everywhere to conquer cancer. Welcome to Your Stories, a podcast where we hear candid stories from people conquering cancer. I'm Sybil Green, your guest host for this month's episode of Your Stories, where we'll discuss an issue that's close to my heart and is an important issue to Conquer Cancer and its parent organization, the American Society of Clinical Oncology, or ASCO for short. Here's some statements I'd like to make, although not happily. Sugar makes cancer spread faster. People with darker skin don't get skin cancer. Lung cancer is a smoker's disease. Drug companies and government agencies are withholding the cure for cancer so they can continue to profit from expensive oncology care. These are just a few examples of cancer-related misinformation you might encounter online or when you turn on the TV or radio. And from misinterpreted oncology information to identity-based stigmas and myths, the spread of cancer-related misinformation runs rampant, and it takes an increasing toll on global health, particularly among certain communities. In fact, in one recent study from Duke University, researchers concluded that minority and marginalized populations are more vulnerable to medical misinformation, and therefore are more likely to experience significant consequences because of it. Joining us today is Dr. Stacy Loeb, a board-certified urologist and a professor in the Department of Urology and Population Health at NYU Langone Health. She's a Conquer Cancer Award recipient, congratulations, and host of the Men's Health Show at SiriusXM. Dr. Loeb has a wealth of experience in and knowledge of the negative impact of misinformation on vulnerable populations, including in relation to cancer. Today, she's here to discuss the growing impact of misinformation and what we can do to help patients stay reliably informed and, as a result, achieve better health. Welcome, Dr. Loeb. It's an honor to have you with us today.
Hi, thank you so much for having me. So happy to be here.
Well, before we get started, let's hear where you're joining us from today.
I am joining you from New York City.
Great. Well, thank you. So let's start with some fundamentals. So in your words, what are healthcare misinformation and disinformation, and what are some of the examples of both in the context of cancer care?
Great question, and such an important topic. Misinformation is really just false information, but it's not shared with any intentional harm, whereas disinformation is really intentionally deceptive. Thankfully, in my research about cancer, most of what we've seen is misinformation, where perhaps the facts have just been misinterpreted and there doesn't appear to be any intentional harm being deliberately attempted on the part of the people sharing the information. However, disinformation may also occur, and we do see examples across the spectrum. We currently have a grant from the National Cancer Institute looking at essentially a typography of misinformation about prostate cancer in Spanish and English in multiple online platforms. And it really spans the gamut, everything from causes to misinformation about screening, about treatment, about nutrition, supplements, survivorship, the relation of sexual activity with cancer, you name it. So very concerning.
We can talk about why misinformation or disinformation is spread. Why do you think it's spread? The catalyst is probably going to be the digital age, I know, but I think the lingering question for me is why.
Yeah, I think there's a lot of factors here. I think the structure of online networks can lead to much more rapid and wide spread of misinformation than we ever would have seen in the past. Unfortunately, what we're seeing is on online networks, frequently the worst quality information actually receives more engagement than the high quality information. So I think there's several problems going on here. For one thing, a lot of the health information that's shared by trusted sources like physicians, hospitals, professional societies is often not presented at a reading level for lay health consumers. And so this lack of readability and too much scientific jargon makes it not very salient for people to see, in contrast with some of the other information that may have more catchy headlines and doesn't use medical jargon. So those are some factors. Another problem with the online environment is that once things are posted online, they basically stay there in perpetuity. And so what happens is something that was true information, good information 10 years ago, it's still there on YouTube. So even if it was shared by the best organization, thankfully, we have such a rapidly dynamic situation in cancer, so many new drugs being approved, guidelines frequently changing, so much more hope now than 10 years ago. But what this also means is that even something that was great 10 years ago probably doesn't reflect the current pathways of care or the current treatment options. And so you'd really have to be so careful because something that was accurate and good by remaining on there forever can actually become misinformative over time.
And when we think about traditional or historic ways of communicating, we can really think about the fact that people just want to share information. I know, so I want you to know. So it goes back to what you said about misinformation and disinformation not always being intentionally communicated as such. It's people just wanting to share information. So when it comes to cancer research and treatments, we started out with some statements. And so we know that there's a lot of it out there, especially now in this digital age. But we also know that certain populations are more susceptible to misinformation than others. So, which communities do you see as having and facing heightened risk of falling prey to cancer related misinformation, and why is that?
So thank you. This is a very important question and something that we've been working on recently and on our research team. And what we find really is that marginalized populations are at greater risk of exposure to misinformation. And if you think about it, if you are part of a group that either has limited access to healthcare, where it's difficult to get in to see a doctor or to afford the healthcare that you need, or part of a population with mistrust in the healthcare system due to some of the historical treatment received by some of these populations, and there's many, then people may be driven to alternative sources of information outside of the traditional healthcare system. So this came up again and again in our studies. Unfortunately, online networks are really pervasive. I guess fortunately or unfortunately, because there's a lot to be gained, but things can also spread very rapidly in these networks.
Mm-hmm, mm-hmm. And so when we think about those populations and we think about some of the access issues in those populations, let's talk about how misinformation and the spread of misinformation impacts cancer prevention and research and treatment survivorship, particularly when it comes to some of these populations. Why is it important for us to talk about it?
Yeah, absolutely. So I think it can really impact across the spectrum. I'll give you some examples. We've seen a lot of misinformation related to prostate cancer, where it's discussing early warning signs of prostate cancer. For example, blood in the urine, difficulty with erections, waking up at night to urinate. These are in many, many posts in online networks. And the problem is, none of these are early warning signs of prostate cancer. Actually, prostate cancer doesn't have any early warning signs. It's totally asymptomatic until it's at a late stage where it's become so advanced that it starts causing problems with urination or spreads to cause bone pain. So I think this is a real problem that this has spread on so many networks because somebody who doesn't have any symptoms watching that post could think, oh, I don't have any of these symptoms. I'm fine. I don't need to worry about prostate cancer. Conversely, someone with a symptom like waking up at night to urinate could hear that and then they become terrified. Now they think they have cancer. And it's almost certainly not cancer. More likely, it's a benign condition, like that they have an enlarged prostate, which is just something that happens with age, which isn't related to cancer. So I think, you can see how either way, whether you have the symptoms or not, it could be very problematic for somebody who's listening to hear something like that. This is just one of the ways. There's also a lot of posts about supplements or a specific food or beverage, like if you drink this juice or you eat these cookies, this can cure your cancer. Now, I'm the first to say that lifestyle is extremely important. In fact, I just got double boarded in lifestyle medicine last year. So I can't underscore how important it is that people eat a plant-forward diet and get physical activity, et cetera. And this is so important along with any management strategy for cancer. At the same time, there is no golden bullet. There's no cure that doctors are hiding from people that we don't want you to know about. We would all want this cure. That's why we're here. We want to conquer cancer. I want someone to put me out of business. So, bottom line, we just don't have the magic bullet. So, as important as it is to fuel our bodies with the best fuel and get physical activity, these are not going to 100% cure somebody's cancer. And so, I think it is also dangerous when too much emphasis is placed. Like if you drink cranberry juice or eat these cookies, because that's just not realistic. And we don't want somebody to think that this can be done in lieu of guideline recommended management options.
Mm-hmm. So there's a lot, right? And you talked about prostate cancer and early warning signs of prostate cancer. That's very different from breast cancer. You talked about plant forward eating. That's very different than all these other diets that are out there that are legitimate. Some are fad. How do patients and their families determine what's trustworthy? What can they look for to know that a source of information is reliable and reputable? And what else should they be looking out for?
Yes, great questions. So, thankfully, there are some checklists online that can be used for patients and families to help vet the quality of information. One of them is from Medline Plus. So, anyone who's interested can look at their website, Medline Plus. It's part of the National Institutes of Health, and it basically gives health information consumers advice on vetting the quality of information. For example, who is funding the site? What is the source of funding? Are they asking you for money for the information? So looking for financial conflicts of interest, looking at the credibility of the source. What is the person's credentials? In our studies, we actually saw some of the misinformation being spread by so-called doctors, people wearing a white coat and describing themselves as doctors. So when we actually went to look up some of these quote doctors in professional licensing databases, some of them we couldn't find. Others were no longer board certified. Only one of the doctors was actually board certified in a field that might deal with prostate cancer. And so even if the person is a so-called doctor, it's still important to verify what kind of doctor are they? Are they board certified? Do they manage the condition that they're speaking about online? And so those are things. And then, what I mentioned earlier about the date. Thankfully, there have been so many advances in cancer research and cancer care. So if something isn't very new, then it may be out of date.
So when a patient comes to you and they say, Dr. Loeb, I read this thing online, how do you, knowing who they are as your patient, knowing how they consume information, how do you help them to best understand the information that they've read or point them in the direction to something that is more reliable?
Absolutely. Well, one thing I can say is that it can be very challenging in a clinical encounter if you are speaking to a patient who's been exposed to misinformation, because it can be very compelling. And it is very important to validate the patient and their concerns and what are the unmet needs that may be driving them toward this. And is there any way that we can help to meet those needs within the traditional healthcare system? For example, if they are seeing a lot of stuff online about supplements or other topics like complementary and alternative medicine, actually, in many of our healthcare systems, we have providers who are board certified in those areas who could speak to them about this. So just trying to really understand what their unmet needs are and how we can help them in a way that is still evidence-based. And then secondarily, I think as healthcare providers, an important part of our role is to give an information prescription. That is not just prescribing drugs, but prescribing what information we think is good that they can see. because let's face it, there's always going to be time constraints in the clinical encounter. I don't have as much time as I wish I had with all of my patients, and I'm sure they feel the same way about me. And it's just very natural that somebody is going to have other questions and want more information than what is possible to cover in that one doctor visit. And so making sure that you give them a list of vetted resources that you support that they can use. That way, they're not just left in this wild west to try to find good information on their own at such a high risk of exposure to misinformation.
And you talked about reputable, reliable sources. You talked about evidence-based information. And obviously, all that comes from research. And I think we can both attest to the data being able to show whatever you want it to show. And there's going to be research on both sides of just about any issue. So, what can researchers do to curb the spread of cancer-related misinformation?
Well, for one thing, I think that researchers should play a role in public dissemination. Dissemination and implementation are so important. And that's why I really tell everyone who's participating in research to get involved in online networks and conventional media. I have a radio show on Sirius XM. I post about my research on social media. And this is not some kind of fluff. This is critical. It's critically important because I'm not going to have the impact with my research if I'm in a bubble and don't share it with the communities of interest. And so actually, if anything, I'd say it's the most important part of research, engaging with your institutional media departments, determining when your research might warrant a press release or other possible media opportunities, engaging with groups in the community, especially if you're working with specific populations. Some of my colleagues do work, for example, in a network of barber shops in New York City to share some of their research. So I think it's just really important to make sure that you're engaging the communities of interest in the research and sharing your research as broadly as possible. And finally, I would say just participating in research on misinformation. It is a really big problem. It's a growing problem. And so I think we need more researchers from all different disciplines to try to figure out how to really address this.
Thank you. So, in the beginning, I said that this was something that was close to my heart, but also mentioned that it was something that was important for ASCO and Conquer Cancer. And just in conversation, you've touched on two of ASCO's three values: evidence and impact. The third is care. So, I'll end on a question that we always love to end on. And I think this gets at that third one, but I'm going to let you answer it. What does conquering cancer look like to you?
So conquering cancer, I think, is really creating a world where cancer is no longer something that anyone has to worry about. I do think we're a long way off, but there's many ways that we could move forward toward this goal. One of them is I think we really need more global and multidisciplinary collaborations on cancer research. And we need to ensure that there is sustained and increasing federal support to accelerate cancer research. We also need a lot more comprehensive research into precision approaches across the entire spectrum, not just for treatment, but even for prevention of cancer, since people who have different genetic backgrounds, for example, may respond differently to different types of prevention options. So I think the precision field is only at the very tip of the iceberg right now, and we have a long way to go to find what is the best treatment for each individual, both to prevent the cancer and to treat the cancer. Also, I think we have a lot of work to do on ensuring accessibility and affordability of cancer care, also building resilience of cancer care to some of the emerging challenges that face the world, such as pandemics and natural disasters, all of which disproportionately impact marginalized populations. And finally, I think that in order to conquer cancer, we really need more research, not only into the efficacy of treatment, but into the full burden of treatment for quality of life and lifestyle, not only of patients, but also of their families, to really give us a comprehensive idea of how we can help people not only live longer, but live better until we have fully conquered cancer.
Thank you, Dr. Loeb. You certainly covered a lot here with great information, no pun intended. But certainly when we think about why we do what we do and how we do what we do, understanding all of the causalities for cancer, but also for disparities and how we can come about just really working to mitigate those things. So thank you so much for your time. I appreciate your passion and your commitment to this and making sure that people have the information that they need so that they can seek the treatment that they need and get the outcomes that they deserve. Thank you for listening to this podcast brought to you by Conquer Cancer, the ASCO Foundation. Conquer Cancer is creating a world where cancer is prevented or cured and every survivor is healthy. You can make a gift to conquer.org/podcast. The participants of this podcast report no conflicts of interest relevant to this podcast. Full disclosures can be found on the episode page on conquer.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.